Hi, I'm Danielle. I'm a nursing student. I'm going to go ahead and prepare my patient's insulin injection. So I did hand hygiene, and I'm going to go ahead and get my gloves so that I'm all prepared for later. All right, so we're going to be mixing our NPH and regular insulin to administer to the patient. And so I'm going to go ahead and open my syringe and my needles, make sure that they're ready. And I'm going to open up my 2 insulins, but first I'm going to check to make sure it's the 6th patient right, so I have the right patient, right medication, right route, right drug, obviously, right documentation, and right time. So I'm going to inspect each of the vials, make sure that they're intact, check the name, the expiration date, and then I'm going to go ahead and remove the caps. And I have multiple alcohol preps here, so I'm going to go ahead and start by cleaning the top of both of the vials. And then this is my NPH insulin, this is my regular insulin. So I'm going to use my U100 needle, and I'm going to open it up. I'm going to withdraw. We're going to be administering according to the order. Patient's going to be receiving sliding scale insulin based on his blood sugar of 245, which is going to be 10 units of insulin, which will actually break down into, which is his sliding scale. Apologies for that. So I'm going to go ahead and draw back the full 10 mLs, and I'm going to inject that into the NPH. And then I did mess up on that. I should have only put in 5, but I'm recognizing that, and I don't want to have to waste the supplies. Anyway, so I'm going to do the same exact thing with the other and the regular, which is injecting the amount of air that's going to go into it. At this point, I would change my needle, and then I'm going to get my alcohol prep ready so that I can clean that later. So now that I have the air injected, I'm going to go ahead and withdraw the 5 units of regular insulin. Bubbles out, and now I'm going to go ahead and draw up the NPH. And the total amount will be 1 ml, or I'm sorry, 10 units. All right. So we're going to make sure we get all the air bubbles out. I'm going to go ahead and recap the needle with the, actually I'm going to go ahead and just close this one off because I'm going to be switching out to the other needle. So I'm going to lay that down, and now I'm going to go ahead and make sure if these are, these are going to be multi-vial. I'm going to put the date and the time and the expiration information on it. And I'm going to initial that when I'm all done with that. So now I'm going to go ahead and go to the patient's room and do hand hygiene and I'm gonna go ahead and go see the patient. So, hi, my name is Danielle. I'm your nursing student today, and I'm gonna go ahead and give you your insulin injection. Can you give me your name and your date of birth?
Skip Rocker 1/1972.
Okay, great. How are you feeling today?
A little groggy.
Okay, well, hopefully this insulin's gonna fix you right up. Are you allergic to any medication?
Yeah, Celebrex.
Okay, all right. Well, that matches your medical record.
I hope so.
All right, well, let's go ahead and clean you up. We're gonna start cleaning your injection site from the inside to the out. And then we're gonna go ahead and inject, or switch the needle, which I should have done before I got to the patient's room.
You're fine, no rush.
All right, new needle's going on. That allowed for that to have time to dry. All right, Mr. Rocker, I appreciate your patience. So it looks like you normally get these at a 45-degree angle. Are you sure of that? Yes. So we're gonna do it in your abdomen. Yes. All right. So I'm gonna go ahead and give it to you at a 45-degree angle. So this would be 90, and this would be 45. So go ahead and give it to 45. We're giving it at a 45 because he's a regular size patient. So then we're gonna go ahead and inject the insulin.
And this should help my sugars go down, right?
Yes, it should help your sugars go down. It should help you feel better. Have you had insulin before?
Yes.
Yes.
Just making sure this is the med.
This is the right medication for you. If you have any questions, I can certainly help you out by answering any of them.
Nope, no more.
Perfect. All right, you got a little bit of blood. I'm going to go ahead and use a little gauze and clean up the blood.
Thank you.
All right, you're very welcome. You take care of yourself, and I'm going to go ahead and dispose of all my sharps and trash and go document in the chart.
Thank you.
You're welcome.